Good afternoon. My name is John Aaron Avalos, a BSN student at Indiana State. This is my presentation on abuse and neglect for population-focused community health nursing. Population group is older aged adults 65 or older. They comprise 14.9% of the total population in the US. At least 10% of adults 65 or older will experience abuse or neglect annually in the US. Sadly, this problem is expected to grow as our population ages. Over 90% of adults reside in the community, and elder abuse is occurring among older adults living in the community. The objectives: by the end of this presentation, you will be able to define abuse, neglect, list the types of abuse and neglect, describe the risk factors, recognize the signs of mistreatment, identifying your interdisciplinary team, state the consequences of abuse and neglect, and summarize the interventions for abuse and neglect. Please pause this presentation for a quick 10-question pre-test to see what you already know about elderly abuse and neglect. Click the link below in YouTube. Abuse causes harm, pain, and mental distress regardless of mental or physical state. It is the willful infliction of injury, confinement, intimidation, punishment, depriving goods and services necessary to their well-being. 4 types of abuse: physical abuse, the deliberate or careless use of physical force or coercion that results in bodily injury, pain, or impairment. Physical violence can also be burning, kicking, pinching, pushing, beating, hitting, shoving, shaking, and slapping. Physical abuse also involves any unwarranted or unnecessary use of chemical or physical means to restrain or confine an elder, such as giving not prescribed medications, punishment, or force feeding. Sexual abuse is non-consensual sexual contact of any kind with an older adult, carried out through force, threats, or the misuse of authority. Sexual abuse includes unwelcomed touching, sexual assault, battery, sexual harassment, and sexual intercourse with elders who are not able to give their consent. Emotional or psychological abuse, the infliction of distress, pain, or torment through verbal or nonverbal acts, including but not limited to verbal assaults, insults, threats, intimidation, humiliation, isolation, and harassment. Lastly, financial, the illegal or improper use of an elder's funds, property, or assets, misusing or stealing an older person's money or possessions, coercing or deceiving an older person into signing any document such as contracts or a will, the improper use of conservatorship, guardianship, or power of attorney. Neglect is the refusal or failure to fulfill any part of a person's responsibility or obligations of care to an elder, which include, but are not limited to, food, water, clothing, shelter, personal hygiene, medicine, comfort, personal safety, and therapy. Self-neglect is another form of self-harm that may occur when provoked or can be triggered by mistreatment. Self-neglect is identified as the actions of an older person that threatens their own health or safety, including the refusal or failure to provide themselves with life necessities. Abandonment is the desertion of an older adult by an individual who has physical custody of an elder or who has assumed responsibility for providing care for that elder. Risk factors for abuse: chronic medical conditions and poor physical health, functional disability and dependence, mental health problems, cognitive deficits, financial dependence, lower socioeconomic status, substance abuse, high levels of stress, poor coping mechanisms, prior exposure to trauma, limited social support, poor relationships between the victim and the perpetrator. The perpetrator's risk factors are similar: chronic medical conditions and poor physical health, mental health problems, cognitive deficits, financial dependence, substance abuse, high levels of stress and poor coping mechanisms, negative attitudes towards the older adult, early childhood abuse. Signs of mistreatment: bruising in unusual locations, burns in unusual patterns inconsistent with unintentional injury, or with the explanation provided. Pressure ulcers, dehydration, fecal impaction, evidence of sexual abuse, soft tissue injuries within the mouth, malnutrition, missing medications, patterned injuries such as slap or bite marks, bright red patches appearing in the whites of the eye, patches of missing hair or scalp swelling, unexplained fractures, unusual delays in seeking medical attention, urine burns such as diaper rash, dirty clothing, or other signs of inattention to hygiene. Signs of emotional abuse are low self esteem, anxiety, frequent crying, feeling afraid, feeling helpless, insomnia, social isolation. Questions for the nurse to ask if they suspect abuse. How are things at home? Are you concerned about your safety? Have there been situations where you felt afraid? Do you have a safe place to go in case of an emergency? The role of the nurse is to collaborate with their peers, persons in the community, and members of the interdisciplinary team. The nurse must demonstrate accountability, make strong ethical and legal decisions. A single case of elder abuse may involve social services, healthcare, law enforcement, and many other legal avenues. Multidisciplinary teams provide a thorough case review across all practice areas. Unified case review is associated with greater collaboration among all agencies, which increases the efficient delivery of services to the older victims of abuse. Multidisciplinary teams continue to replicate across urban and rural communities across the country as a response to elder mistreatment. Multidisciplinary teams have demonstrated promise as an effective intervention in providing holistic support for the elder community. I'll list some of the most important interventions: interpersonal and community-based support through awareness campaigns, behavior therapy, keeping elders safe, random home visits, welfare assistance, mandatory elder abuse reporting, many laws for elder abuse, screening interventions, holistically embracing the victim's relationship with the offender, the context of abuse, and the home environment. It's important for the elder person to determine their own outcome or goal from a stated intervention. High quality research is a requisite to reevaluate and affirm best practice strategies to address elder mistreatment. Consequences of abuse. Federal laws have been implemented in order to protect the elderly from abuse. There is the Older Americans Act, passed in 1965, the Vulnerable Elder Rights Protective Activity, which was passed in 1992, and in Texas we have Texas Administrative Code Title 22, which states this rule requires that the nurse must report any nurse whose actions constitute abuse, exploitation, fraud, or a violation of professional boundaries. Abuse of an elderly person is a third-degree felony, punishable by 5 years in prison, 5 years probation, and a $5,000 fine. An elder neglect patient can be a second-degree felony, getting you 15 years in prison. Nurses are obligated to report suspected abuse of any kind, report immediately to a supervisor and to Adult Protective Services. Currently, there is no federal law regarding elder abuse in the United States, but individual states do have laws for reporting, investigating, and prosecuting abuse. All reporting is confidential. Here are some additional resources to help you if you suspect anybody is being abused. Take a pause of this video to take a 10-minute post-question survey to see what you have already learned about elderly abuse and neglect. Here are my references. Thank you for listening to my presentation. Have a wonderful